finish talking about Chapter 1 material, finish up your introduction to anatomy, and we'll talk a little bit about cells. You should have talked a lot about cells in Bio 111, so I'm not going to talk a lot about cells, but there are some things that we need to talk about to get ready for discussing tissues, which begin next week. Tissues, there are a lot of different tissue types, and they can kind of feel overwhelming at first, but they're really important because they tell you what different layers of different organs are good for and what different organs can do by seeing what tissue is present. So we do need to talk a little bit about cells today, but we're going to start by finishing up our language of anatomy. So when we talk about anatomy, we always look at a body from the standard position, anatomic position. And in anatomical position, a person is standing with their feet slightly apart and your palms facing forward, which means your thumbs are lateral. And this we use as a standard so that no matter what way you find a body or come across someone, you can know what we're talking about using anatomical directions. So like if you're in forensics and you come upon the scene of a crime and somebody's upside down and they've got their leg all cockeyed up over their head or whatever, and you need to describe something like an injury, you could say, oh, they've got a gunshot wound that is superior to a stab wound, or something like that. Or if you walk in upside down, and we're talking about like a gunshot wound here and a stab wound here. The gunshot wound is superior to the stab wound, even though this body's upside down. And that's because we're talking about a standard position that starts with anatomical position. So this is a figure of what anatomical position looks like, and we can use directional terms to describe different things around the body based on anatomical position. So this is kind of your first part of learning a new language, is learning all of these directional terms. So our first we can start with is superior. And superior means towards the head. These are directional terms. So you can't just say, oh, this spot right here is superior. This spot is superior to this spot. So superior means towards the head, relative to something else. The opposite of superior is inferior, which means towards the feet. You can also think of this region as your cranial region, so sometimes you'll see as a directional term towards the head, cranial. So this is also towards the head. But if you're looking at something, say, on the torso, you wouldn't say, like, this X is cranial to this O. You would say the X is superior to O. Cranial is really referring to, like, on the head, towards the head. Other directional terms that we have that we use pretty frequently are anterior and posterior. Anterior is towards the front. Now, on animals, all of these directional terms are going to be slightly different. On quadrupeds, that's why I drew this little cat up here. So we'll look at that in just a second. Towards the back is posterior. So if we look at this cat, anterior is going to still be towards the front this way. Posterior is towards the back that way. Superior is up towards the head. Inferior is down towards the feet. Because animals are at a different arrangement than humans are, we have these other terms that we use, dorsal and ventral. And these are going to look quite different on the human and the cat. So we'll see in a little bit, we have this cavity in the back that holds your brain and spinal cord, and it's called the dorsal cavity. So dorsal on a human is more like in posterior, because it's towards the back. So dorsal is towards the dorsal cavity, but if you look on a quadruped, their dorsal cavity is here. So dorsal on a quadruped is more similar to superior. The other cavity that we have in the front of the body is the ventral cavity. So for us, ventral as an anatomical direction is similar to anterior. But for quadrupeds, their ventral cavity is down here in their belly, so that's more like inferior. Other terms that we use primarily in animals, but can be used in humans, are rostral and caudal. Rostral is kind of this weird direction up toward the nose, so it's like an angle. Rostral, you can remember rostral is toward the nose because rostral sounds like nostril. The opposite of rostral is toward the tail, and it's called caudal. So we have a tailbone, so caudal for us is towards the tailbone. So it's kind of like inferior and posterior, where rostral is kind of like superior and anterior on us. Looking at this figure over here, the other terms that we have for toward the middle and toward the side are lateral and medial. So if you're pointing away from the midline, you're lateral. If you're coming back toward the midline, you're medial. So you could say your belly button in anatomical position, your belly button is medial to the palm of your hand. It's closer to the midline. Really the last anatomical directional terms that we need to worry about are more referring to location within the body. And so if we flay him open, so he's laying out like this would be its midline. So, pardon me, this is not. So if you look at your arm, we've got skin that's superficial, and then we've got muscle that we'd find next, and then the deepest structure is our bone. So superficial is the outermost surface. And this is really, these directional terms are really important because we're going to talk about different layers of different organs. And the superficial is always the outermost layer. So our purple layer would be intermediate. So if this is the arm and this is the muscle, it's intermediate. And intermediate is between superficial and deep. And our bone is the deepest layer. And this is deep, and it's just the farthest from the exterior. The other thing you have to know are our regional terms. So regional terms are covering different body regions, and we have quite a few. Referring to the head, there are a bunch of different regional terms we can use for the head. You can call the whole head, like your cephalic region. You can also call it the cranial region. So that's what's weird about cranial, is both used as both a directional term and a regional term. So cranial and cephalic are both referring to the head, but we can look at the head and there are different parts to the head. And we'll see this when we get to the bones. This bone in the front of your head is your frontal bone. Behind it is the frontal lobe of your brain. So this is the frontal region. Orbital refers to your eye. Your eye, there's an orbit that is made from many bones that hold your eye. So orbital is referring to the eye. I guess I can write these over here. So frontal is referring to like your frontal bone, forehead region. Orbital is referring to your eye region. Nasal is referring to your nose. Oral refers to your mouth. Mental refers to your chin. That one's kind of weird. So sometimes when you're really thinking hard, you'll scratch your chin. So when you're being really mental, you can mess with your mental region. Another one that's not on this picture is buccal. Buccal refers to your cheeks. So your cheeks are your buccal region. Then if we look next, this region here is your thorax. So this whole, your whole trunk is what we call your axial area, or your axial region. So let me write that over here. Axial is referring to your head, your thorax, and your abdomen. Appendicular is referring to your appendages, so your arms and legs. So the next part of our axial body, usually you hear it as axial skeleton and appendicular skeleton, but your book is referring to it as regions as well. So the next part of your axial region is your thoracic region, which is this area here in your chest that holds your heart and lungs. So for another body region, we could say that we've got the thoracic region, and And this is referring to what we commonly call like our chest area. The subregions within the thoracic region are the sternal area, which is here above your sternum, which is your breastbone. So sternal is referring to the breastbone region. This next region is a small region in your armpit, your axillary region. So if I ask you where you put deodorant, you put it in your axillary region. And then the region just superficial to your pectoral muscles is the mammary region. Also kind of like, you can think of it as like the breast region. The last part, I'll come back to that in a minute. The last part of our axial body is the abdominal pelvic cavity. So if we look first at your abdominal region, this is this big region that holds most of your guts. And in the middle of that, we have what we call the umbilical region. That's where your belly button is. So we've got your abdominal region. And this is where most of your squishy organs are. So, I don't know, kind of like your belly region. And then within the abdominal region, we have the umbilicus, or the umbilical region. And this is specifically referring to the area around your navel. Inferior to the abdominal region, we have the pelvic region. So our pelvic region, frequently you'll see that like abdominal pelvic cavities come together, but we can kind of split them as well. So our pelvic region is inferior to your abdomen. And if we look in the pelvic region, or just inferior to that, we've got this region called the inguinal region, which is kind of referring to the groin. I don't really like this picture pointing there, because the inguinal region is really off to the sides. So if you look back here on these models, you can see this medial portion would be the pelvic region. Right here on the side is the inguinal region. This is called the inguinal, there's a hole here called the inguinal canal. I don't have a good skeleton out here to look at it right now. You can look at it actually right here on the skeleton. The inguinal canal passes from your leg up into your pelvis. So inguinal is kind of lateral to pelvic. This middle region right here, this medial region, would be the pelvic region. And then lateral to that are our inguinal regions. So inguinal is referring to your groin, but more referring to the lateral part. So we'll say inguinal is like lateral to the pelvic region. So that's all of our axial regions. Next we need to talk about our appendicular regions. So if we look at our upper limb, frequently known as the arm, we've got this region, your shoulder bone, is called the acromial region. And when we look at the skeleton, we'll see that we've got this extension of your clavicle, or not clavicle, your scapula is the acromion. So that's your acromial region, it's like your shoulder region. The upper part of your arm, where your biceps are, is referred to as the brachial region. So brachial is your upper arm. This anterior portion in front of your elbow, if your elbow is posterior, this anterior portion right here, we call the antecubital region. So this is where they draw blood. So we'll just say this is the front, or we'll say anterior to your elbow. And then your forearm we call the antebrachial region. Your wrist area is full of these bones collectively called carpals. So the regional term for the wrist is the carpal region. Your whole hand is called the manus, and it's got different portions. So your whole hand is called the manus, or the manus region. Your thumb is called your pollex. So if you're referring to the thumb, your pollex is like your most lateral structure. The palm of your hand, we refer to that region as palmar. And then your fingers we refer to as the digital region. You've got two digital regions. Your toes are also called digital regions. So if you're asked about the digital region, you just have to, there will have to be something that tells you which part. Are we on the upper or the lower limb? So if we're referring to the digital region on the upper limb, we're referring to the fingers. Okay, for our lower limb, our regions are coxal. The first region, coxal, is referring to like your hip area. Your thigh is referring to the regional term for your thigh is your femoral area. So your femur is the big bone that runs through there. So it's the largest bone in your body. So our femoral region is our thigh. Your little kneecap is a bone called the patella. So in the anterior portion of the knee, we call this the patellar region. Your lower leg is what we call your leg. And as a regional term, we call it crural. And this is what most people think of. When you think of your leg, most people think of the whole lower limb. But leg is, as an anatomical term, is really referring to your lower leg. And we call that the crural region. Kind of on the lateral side, we have the lateral side of the lower part of your lower limb. We call this the fibular region, or perineal. I very rarely see it called perineal. But your fibula is this bone over here on the lateral part of your lower limb. So that's the fibular region. So we'll say this is lateral leg. Your ankle, your whole foot region gets clumped together as the pedal region. And then if we look at the different parts of it, your ankle is a bunch of bones that are collectively called your tarsals. So all of these guys down here are your tarsals. So your ankle is your tarsal region. I just realized I missed two of our directional terms because I was going to say them. So distal means further away from the point of origin. I'll show you that and I'll write it down in a minute for you. But if these are our tarsals and our leg's point of origin is up here at the coxal region, then when we go further away, distal to our tarsals are these bones called metatarsals. So metatarsals are referring to, like the palm of your hand has your metacarpals. Your metatarsals are like making up the bulk of your foot. So we'll say that your metatarsal region is between your ankle and your toes. Your hallux is your big toe. And then again, we say that we can say digital for all of the rest of your toes. So let me give you those other two anatomical terms really quickly before we move to regional terms on the posterior aspect of the body. So we have two more regional terms that are really referring to the limbs. And they are proximal and distal. So proximal means closer to the point of attachment to the trunk. Distal means further from the point of attachment to the trunk. So your pedal region is distal to your patellar region. Your coxal region is proximal to your patellar region. So proximal is closer to the point of attachment, distal is further from the point of attachment. We don't really use proximal and distal in the axial body, we really just use it for appendages. So that's referring to your neck, all of the bones in your neck are cervical bones. So this would be cervical region. So the cervical region refers to your neck, but we can also see that on the posterior side. So if we look at our posterior picture, we're started our appendicular skeleton again. On this posterior image, we can see some other regional terms. Again, our cephalic region is our head. On the head, we can see the ear is referring to otic. So this is your ear region. Occipital is the back of your head. We'll see that here. This is your your occipital bone. It's protecting the occipital lobe of your brain. So this is the occipital region. Cervical is referring to your neck. So both interior and posterior, we would just call all of your neck the cervical region. Again, we can see our acromial region is the shoulder. Our brachial region is this upper arm. We have a different name for the back of our elbow. It's the olecramal region, and that's because this big process right here is called your olecranon. That's what we frequently think of as our elbow, is this olecranon process of your ulna. So we call the back, the posterior aspect of your elbow, the olecramal region. Again, we can see a mantis is our hand. All of these bones now that we see on the posterior side are our metacarpals. So that's the metacarpal region. And so our metacarpal region is between our wrists and our digits, or between what we can say between our wrists and fingers. Digital, again, referring to the fingers. Femoral, we've already seen, is referring to the thigh. The posterior aspect of the knee also gets a different name. We call this the popliteal region. So this is your posterior knee. And I always remembered that popliteal rhymes with heel, so the popliteal is on the heel side. Also, another thing you can call the heel of your foot is the calcaneal region. So popliteal and calcaneal both rhyme with heel and are on the posterior side. So popliteal is your posterior knee. Referring specifically to like your calf, we call that sural. So that would be the posterior part of your leg. Again, the lateral part is fibular or perineal. On the heel region now, on the posterior surface, we can see these other regions. The calcaneal region, which is your heel. It gets that name because this big bone is the calcaneus. So it's the calcaneal region. And then, like your palm is your palmar surface. The bottom of your foot is called your plantar surface. So this is the plantar region, and you can maybe think that people get plantar warts on the bottom of their foot, and that can help you remember that's the plantar region. So over here, if we look at your back, this is again the dorsal cavity. So dorsal is probably the more appropriate term for a regional term. We've got this region, the scapular region, that is surrounding your scapula. So it's kind of like what we think of as your shoulder blade. So for our back, this is like the dorsal region. And we can say that we've got our scapular region, which is like our shoulder blades. The vertebral region is the medial portion of your back that's surrounding your vertebral column. So all of this would be your vertebral region. So we'll say this is your medial back. Your lumbar region is kind of your lower back, where your lumbar supports in your car, you inflate them, and it helps give you some support in your lower back. Still, it's going to be lateral to our vertebral region though. The vertebral region is covering the whole vertebral column. And when we look at bones, we'll see that we've got cervical vertebra, thoracic vertebra, lumbar vertebra. So our vertebral region is the whole vertebral column, but lateral to that, we would call this down here, the inferior aspect, our lumbar region. So for lumbar, we'll say this is lateral to vertebral column, or to the vertebral region. And inferior to the scapular region. Your sacral region is this really inferior part. This bone with all these fused vertebrae here is your sacrum. So this is your sacral region. That's between your coxal regions. We'll say sacral is like your really inferior lower back. And it leads into your tailbone, which is called the coxal region. I don't see that on this picture, but we'll talk about the coxal when we get to go. Your gluteal region is all of those meaty muscles on what they're sitting on your glutes right now. So your gluteal region is all of those muscles in the back. I mean, let's be frank, most people call it your butt. So your gluteal region is like your buttocks. Your perineal region is this area between the anus and the external genitalia. So we hardly ever talk about the perineal region. We'll talk about differences in male and female perineal regions at the end of next semester when we talk about reproduction. So the perineal region is just kind of this odd area in between the anus and genitalia. And that covers everything on our posterior aspect. Any questions on that? Okay, so the next thing that we need to talk about are body planes and sections. Body planes are imaginary lines that we put through an organ or a body. So plane is an imaginary line. We'll say through an organ or a body. Sections are actual slices of tissue from a given plane. So if we look at this person standing in anatomical position, if we draw an imaginary line that separates this person into anterior and posterior, it's a frontal plane. So frontal, or this is also called coronal. So both are acceptable terms, and what frontal does is splits into anterior and posterior divisions. So this is showing you a frontal plane, an imaginary line through this person's body. Now if we take a slice of tissue and look at it, then this is a frontal section. So, and this is a section through the torso. So it's taken from the frontal plane, but it's an actual section of tissue that we're looking at. So this, when we're looking at this frontal plane, it's just an imaginary line. So our next type of plane is called transverse. That's this one here, that's splitting this person into superior and inferior. So transverse also has two other names that are acceptable. Horizontal plane is acceptable, as is cross-sectional. So you can have a cross-section of cross-sectional tissue, which is, or a cross-section of tissue through the cross-sectional plane, which is kind of weird, but you're going to have to know all these terms someday, so I'm just going to tell them all to you. So primarily your book is using transverse, but horizontal and cross-sectional are also acceptable. And this splits into superior and inferior. So we can see if you slice some tissue through our transverse plane, it will give us a transverse section. You can see this is the spinal cord, this is the liver, the spleen. We're looking down at all the guts. So that is a transverse section through a transverse plane. This is showing a median plane, which is kind of limiting because it's specifically referring to what we call a mid-sagittal plane. A mid-sagittal plane splits into equal left and right portions. So mid-sagittal is the same as median. I like mid-sagittal better than median, but you can use them both. And this splits into equal left and right. We can have unequal left and right sections or planes, and so those we just call sagittal. So a sagittal plane into unequal left and right portions. So if you cut somebody like through their eyeball straight down, then that would be a sagittal plane or a sagittal section. Yes. Okay then, the next thing we need to talk about are body cavities. And then we're going to talk about membranes and body cavities and quickly go over a little bit about cells. So your dorsal cavity is the cavity that surrounds your brain and spinal cord. So, and the membranes in the dorsal cavity that are protecting those soft organs from the hard bones are called meninges. And we'll talk more about meninges when we get to the nervous system. So your dorsal cavity can also be split into the cranial cavity that specifically holds your brain. So this holds brain and your vertebral column that protects your spinal cord. So your dorsal cavity is found deep to your bones here. And your cranial cavity, the cranial division of the dorsal cavity protects your brain. The vertebral column, your vertebral column is protecting your spinal cord, your soft spinal cord. The membranes in the dorsal cavity are called meninges. And they are tough connective tissue membranes that are protecting these soft organs from those hard bones. So we're going to talk about tissues starting on Tuesday. They're really interesting. So these are tough connective tissues, membranes that protect our soft tissue from the bones. We'll talk specifically about meninges and what they're made of when we get to the nervous system. Here you can see the dorsal cavity is this region in the posterior aspect. It's got the cranial cavity that contains your brain, the vertebral cavity that contains your spinal cord, and then those soft tissues are protected by membranes called meninges. We'll talk more about those later in the semester. The other cavity that we have is the ventral cavity. So our ventral cavity is found in the anterior aspect, and it can be split into your thoracic cavity, your abdominal cavity, and your pelvic cavity. So this contains your thoracic cavity, and your thoracic cavity protects is even broken down even further. It protects your heart in this region called the pericardium, protects your lungs in this region. These membranes here are called pleural membranes or pleural cavity. And then we've got this other membranous partition that comes and surrounds the great vessels of the heart and the pericardium itself, called the mediastinum. So the thoracic cavity is protecting our heart and lungs. And within it, we have other cavities, other divisions. Pleural cavities, which protect lungs, the pericardium, which protects your heart, and the mediastinum, which surrounds the great vessels of the heart and the pericardium. So that's the thoracic cavity. The thoracic cavity is superior to the diaphragm. So it is above the diaphragm. I don't know how many times I've asked people, when we get to abdominal pelvic regions in a minute, we'll talk about this, but I've asked people to tell me, what are some organs in the right upper quadrant of the abdominal cavity? And people tell me lungs. Lungs are not in the abdominal cavity. They are in the thoracic cavity. They are superior to the diaphragm. So your thoracic cavity is superior to the diaphragm. Inferior to the diaphragm, we've got the abdominal pelvic cavity. Some books just lump them together. Some people break them apart. Your book breaks it apart, so that's how we'll talk about it. So inferior to the diaphragm, we have the abdominal and pelvic cavities. The abdominal cavity contains all of our digestive organs. And the inferior-most cavity is your pelvic cavity, and your pelvic cavity contains your bladder, your reproductive organs, and the most distal part of your GI tract, the rectum. So it's got your urinary bladder, your reproductive organs. So the membranes that are found in the ventral cavity are called serous membranes. Serous membranes are different than meninges. Meninges are tough connective tissue sheaths that are holding those organs stable. Serous membranes are fluid, and they allow the organs in your ventral cavity to move past each other without rubbing up against each other. So a way to think about a serous membrane is if you were to punch your fist into a balloon, there's going to be a layer that's hugging your fist tightly. We call that the visceral layer because your organs are called viscera, collectively called viscera. So our serous membranes have two layers, and they are secreting serous fluid between those two layers. So a great example of a serous membrane is the pericardium, and it's kind of specialized. It's got a third layer we'll talk about next semester. But if you think about it, your heart is continually pumping. So it has to be able to move in your chest without rubbing up against your lungs, because that would hurt. So both of your serous layers are secreting this fluid into this cavity called serous fluid, and that allows your heart to beat and move without rubbing up against anything else. So our serous membranes are double-layered membranes. They have an inner visceral layer, and this tightly holds the organ. And then they've got an outer, like if you were looking at the outside of the balloon now, most of the balloon would be equivalent to your parietal layer. Your parietal layer is the outer layer that is in contact with the wall of the cavity. Both layers secrete serous fluid into a serous cavity, and that is going to reduce the friction as these organs move. So the specific name for the serous membrane that covers the heart is the pericardium. So that's the kind of the thing about our serous membranes is now they all have specific names depending on what organ they're covering. So the pericardium is not only like this cavity in our thoracic cavity, it's also the name of the serous membrane that protects the heart. So your pericardium is the serous membrane surrounding the heart. Your pleural cavities are full of your lungs, which are surrounded by pleura or pleural membranes. So this is our pleural cavities have our pleura, and these are the serous membranes of the lungs. The mediastinum is also a serous membrane. It's a membranous partition that separates the pleural cavities from the pericardium and surrounds the pericardium. And what that's going to do is it's going to help to prevent passage of infection from one of these vital organs to the next. So we'll see in the abdominal cavity, all of our serous membranes are connected. In the thoracic cavity, they're not. And if you think about the organs in your thoracic cavity, they are vital to living. So if one lung gets sick, we want to kind of prevent the easy passive passage of the infection to your heart and your your other lung, and we can do this by separating each of these organs in their own serous membranes. Your abdominal pelvic organs are covered in a serous membrane called peritoneum, and peritoneum is pretty continuous. I'm trying to see if we've got it on a picture anywhere. I don't see it. So peritoneum is the serous membranes of your abdominal cavity, primarily of your abdominal cavity. Your urinary bladder has a little bit of serous on the most superficial portion of it. So we'll say these are the serous membranes of abdominal organs, and we call them peritoneum. Now, not all organs in the ventral cavity are peritoneal. Your kidneys are what we call retroperitoneal. They sit outside the serous membranes of the abdomen and are covered in what are called perirenal fat pads. We'll talk more about that next semester. All right, I'm actually going to let you review the abdominal pelvic quadrants and regions on your own because I want to at least talk a little bit about cells. So, and this isn't something that we'll talk a lot about in anatomy and physiology, but this is something that you might have to know, let's say, if you're going to be an EMT. And these are just ways that we organize, we split the abdominal pelvic cavity. We can do it into different quadrants, or we can do it into 9 different regions. So, look this over in your book. I didn't give you something on this. I'll bring you a practice homework on Monday to have you just review your abdominal pelvic quadrants and regions, but it's just different ways of splitting up the abdominal pelvic cavity so that you could specifically talk about organs in it. So if you've got a person who has pain in their, you would say their right lower quadrant or in their right iliac region, maybe they have an appendicitis or something like that.